Welcome back. Day 4 of the Menopause Energized 30-Day Healthy Heart Marathon. Hey, you guys, this is Sheila. Welcome back to day 4 out of the 30 days of the Healthy Heart Marathon. Yesterday, day 3, we went over know your numbers. So we went over to know your values when you go to the doctor for your blood sugar, your hypertension, your cholesterol, and some seem to forget that's important as well, your vitamin D level. We're going to have that roll right into the 2 today, and I won't keep you long. Since we're talking about numbers, I'd like to discuss a couple of these problems that can happen in our menopausal years. So today I just want to go into a little more detail about high blood pressure because it is what we consider the silent killer. High blood pressure and menopause, the silent killer, sometimes you cannot feel. You may feel fine, especially if you go unchecked, if you're not having your yearly physicals by your primary care doctor. Sometimes people think they're okay, but they got stuff brewing up in their system that they have no idea what's going on. Now, sometimes there is some of us that do get symptoms, but a lot of times, I'm going to keep mentioning this throughout the whole 30 days, our body is our protector, not our enemy. It gives us, I call it silent whispers. Somebody may say, well, you're repeating the same thing twice. That's just what I use, silent whispers. Sometimes our body is trying to tell us that something is wrong, and we do ignore it. And we all do it because we have a busy lifestyle. Maybe we just don't think twice about it. And sometimes some people think nothing can happen to them, and it can happen to anybody. Okay, so basically, when your blood pressure goes unchecked and you finally go into the doctor office and it is high and it's been high for a while, we talked about this yesterday, I believe, it will start to affect your heart, your kidneys, and your brain. Research shows that half of adults go with high blood pressure and have no symptoms. No warning signs. But guess what? A blood pressure cuff can give you a warning sign. And I think we talked about that yesterday. I think it suggests all women, especially in their menopausal years, since we're at more high risk for cardiovascular disease, and it is the #1 killer in us, to have a blood pressure cuff. But remember yesterday when I talked, we don't let these instruments or equipment control us. We control it. In other words, you're not going to run and take your blood pressure every 5 to 10 minutes because you feel funny. And we talked about that yesterday. Okay, so now, here are some of the symptoms that you may have. Now, we all know that in this world today, one symptom, like a headache, could be 1,000,001 things. So I think that's another reason why some of us fail to get things checked out and to go to the doctor. Because if you have a single headache, that could mean anything. And then there's people, of course, that are hypochondriacs, which I am a little bit, because I've been a nurse for so many years, unfortunately. I do try not just to be a hypochondriac. With the experience that I know and the knowledge I have, I do try to narrow certain things down. But I am a little hypochondriac. So your headache could be from anything. I would say you have to put more together than just that one symptom sometimes. But if your headaches are sticking around for a while, everybody gets a tension headache every now and then. But if you find yourself where your headaches are sticking around for a while, like every day, just more frequently, again, it could mean something else. I could name 100 million things that it could be. But you may want to get it checked out. And if you got your blood pressure cuff there, check your blood pressure. Dizziness. So like I said, sometimes you got to put a couple of those symptoms together. If you have headaches and dizziness, again, it could mean something else, but that is 2 of the symptoms that come along sometimes with the high blood pressure. Blurred vision. Yes, people do get blurred vision with high blood pressure, and I'm going to go into that a little bit more in just a few minutes. Shortness of breath. Yes, because if your blood pressure is really high and it's constricting, because when your blood pressure is high, your blood vessels constrict. So when the blood is trying to push through, it's having a hard time getting the oxygenated rich blood cells through to get to the heart. So if the heart is not getting that, or if the lungs, remember I told you the other day, the heart is connected to the lungs. Sometimes what goes on with the heart goes on with the lungs. Then those lungs are constricting as well. They're not getting the oxygen in that they need, and you will experience some shortness of breath. And remember what I said, for some women, shortness of breath is also a sign possibly of a heart attack as well. But it's not just the shortness of breath now. Remember, that can come with asthma or anything else. Sometimes you got to put these symptoms together. Chest pain as well, because your blood vessels are constricting to the heart. So if, you're not getting the oxygen and the flow there. So of course you're going to get some chest pain. Palpitations all comes along with the heart. Yes, sometimes you can have palpitations when your blood pressure is high. Not everybody. Everybody has his own individual book. You can't clump everything together. Then this is very rare, but some people can have nosebleeds. Now, I don't want someone to run around and think that every time they get a nosebleed, their blood pressure is high. But I've had patients that have had nosebleeds when their blood pressure is high because the vessels in your nose is tiny, really tiny. So any little bit they're going to constrict. Everything in your body is going to constrict when your blood pressure is high. So they're going to constrict, and they can't afford much pressure on those little tiny veins, so they will burst. And like I said, it's a very small percentage of people that do have nosebleeds. And then I said I would come back to the blurred vision because I want to talk about TIAs. A lot of people, when they have their blood pressure is really high, will have transient ischemic attacks, TIAs, that temporarily affects the brain. And that could possibly give you the blurred vision. It can give you slurred speech. You actually can get some numbness or weakness in your extremity. But with TIAs, it goes through the brain, the constriction, and it may die down. It's temporarily, it's not permanent. Those symptoms will dissipate, especially if you're in the hospital and they can get that blood pressure down. They will dissipate. TIAs usually do not leave a permanent damage. And of course, I'm just saying here, I'm just talking about high blood pressure, but of course I'm just saying, well, since we're talking about the TIAs, what we call CVA, cerebrovascular accident, you don't have to take this down. That is the permanent form. That's what we call a stroke. That can lead to permanent damage. And over a period of time, if you have really high blood pressure, that's what you will have. Sometimes when patients used to come into the ER, they would have a bleed, which is a brain aneurysm that could possibly be from blood pressure being really high over an extended period of time, or blood pressure being just really high. I'm going to give you some numbers. Sit down. Make sure you're sitting down for this because it is true. I've seen patients with blood pressure 250 systolic over 120 diastolic. That brain cannot take that much pressure. So the vessel in the brain starts to balloon, and then it can't take the tension anymore, and it bursts. And that's when you have the bleeding in the brain, and unfortunate for some, it's not a good survival rate. You can also with a stroke, there are two types of strokes. There's the one that bleeds out, and then there's the one that just forms a clot that don't burst. That's when clots travel from other parts of the body into the brain. That could be, let's put it all together, what we talked about the other day. High cholesterol and other things, plaque breaking off, plaque that can travel to different parts of the body. One is the brain. And also blood clots come along with that. There's a whole scenario that works along with plaque breaking off and the body producing blood clots. It's almost like a triage type of thing. And when that goes to the brain, your circulation is cut off. Again, the clot does not burst. It stays there, but it's blocking the circulation to the brain. And that's when you can have that type of stroke. So there's really two different types of strokes. The one with the clot, the brain, sometimes they will use a blood thinner that they inject to dissolve the clot. For the bleeding, of course, they don't do that because it's bleeding, so they don't use anything. There's other type of measurements. Usually, a lot of times, patients have to go for emergency surgery. So just give you a tidbit on that. So again, we talked about this already. We said the heart attack could happen from high blood pressure, the stroke, and heart failure. And we're going to go over a little bit of that tomorrow. So anybody that's on here that's in their menopausal stage and have a history of CHF, which is congestive heart failure, or if you don't have congestive heart failure, still a good video to watch, because these are the conditions you need to watch out for if you have a history of high blood pressure or you've been diagnosed with high blood pressure. You want to make sure you know a little bit about this, so hopefully you will never get to that point. And then the kidney disease, it can affect, again, constricting every organ. If you're not getting the blood flow through the kidneys, those, we call them nephrons in the kidneys, die. And usually they cannot be regenerated. And then you start to have some problems with your kidneys. And then we talked about the vision already. Blood vessels in the eyes constrict, and that can cause the blurred vision that we just talked about. So just very briefly, I just wanted to give you that, the symptoms to look out for if you have high blood pressure. If you have a blood pressure cuff, take your blood pressure. If you're experiencing any of these symptoms, ladies, we can control and decrease our risk of cardiovascular disease. We can. I know it takes a lot. You got to be motivated. Your mind has to be set and be there. And soon we will be having an 8-week coaching program coming out, and I talk about all that. I don't discuss anything until we get the mind ready first. When that mind is ready and set, then we go, because I don't see how we can manage anything if the mind is not there and motivated and ready to go. And since we keep talking about blood pressure, and I was saying that it would be good if you own a blood pressure cuff, I just want to go over a few tips, and then we will be done for day 4. And tomorrow we will talk about the congestive heart failure. That is really important. Blood pressure readings should be taken the same time every day, if you can. I know life is busy, but if you can, you'll get a more accurate reading. Also, sit 5 minutes before you take your blood pressure. I'm going to be honest with you. Sometimes if I take mine, I don't wait 5 minutes, but you really should wait 5 minutes. It can make a difference in a few points up or down. So you want to wait, you want to sit still and wait 5 minutes. Just to let you know, if you go into the doctor's office and you go in and they rush you right back and you this and that and you get nervous, you will find your numbers up a little bit when you go to the doctor's office. All due to that and being anxious as well, finding out what your blood work is going to be, things like that. So it may be a little high when you're in the doctor's office. Also, do not take your blood pressure after you have drank caffeine, or you're stressed out, or you just finished exercising. Now, when I say stressed out, if you're feeling symptoms, definitely take your blood pressure. But if you're just stressed and you're running around and you're doing this and that, wait 5 minutes before you take your blood pressure. But of course, if you're stressed and you start to feeling symptoms, because people that have anxiety attacks, they will get sometimes some of the same symptoms, being dizzy. That's why I said some of these symptoms could be attributed to a whole lot of different things as well. But sometimes people with stress and anxiety will get dizzy, and of course the blood pressure will go up. Change your batteries frequently when you get the electronic blood pressure cuff. A lot of people don't really do the manual now. It's harder to try to teach how to do. And for some people, it's really hard hearing that beat, especially when it disappears. So you may be getting more inaccurate numbers. So most people today use the electronic one. They're not really that expensive. Everything in this world today is going up in price no matter what, but they're really not that expensive. But that blood pressure can tell you a lot, and of course it has the pulse rate on there as well. We didn't discuss pulse rate too much. We will go into that in the latter part of the week, because I will be talking about palpitations and arrhythmias as well that comes along with all of this. But yes, change your batteries frequently. To give you an example, there was someone I knew who did not change their batteries in their blood pressure cuff for a while. They got really sick, didn't know what was going on, and they were getting a reading of 90/60. So they thought it's because their blood pressure was low. Unfortunately, because the batteries were dead, it wasn't that the blood pressure was low. The blood pressure was actually like 180 over 110, and that person did wind up was having a stroke, symptoms of a stroke at time, and actually wound up having a CVA. I like to say that's cerebrovascular accident, so you guys can get used to the two term. So definitely change your batteries frequently. That is really important. And did I say this? If didn't say this as well. If you feel like you're getting an off reading on your blood pressure machine, don't take that first reading right away. Wait a minute and repeat it. So if you feel like the number is off a little bit, it don't sound right, just don't take the cuff off your arm and think that is your reading. Just wait a minute and retake it. Proper size cuff is important. If you put a tiny cuff on someone that's got a bigger arm, you're going to get a false high reading. If you put a huge cuff on someone that has a little teeny arm, you're going to get more of a lower reading. So you definitely have to need to have the proper size cuff. Also, no crossing legs. When you cross legs, you're impeding the circulation to get back up into your heart. So you may be off a little bit with your numbers. So don't cross your legs when you're taking your blood pressure. Also, when you're taking your blood pressure, keep it at the level of the heart. Don't sit down and take your blood pressure and you put the cuff on and your arm is hanging like this. You want to keep it at the level of your heart when you're taking your blood pressure. You also want to keep a journal. You don't have to keep a journal if you don't want, but if you've just been diagnosed with hypertension or your blood pressure medicines need to be adjusted, you want to keep a journal. And I tell you why. When you go into that doctor's office and they get that one reading, because that's all they know. They only know about the one reading in that office. And if they see like 160 over 90, they may tell you to start cutting down, watch your salt diet and all that. Every doctor's different. But then there's some doctors that may put you on medication. But if you are not on medication, of course, they're going to probably go by, it depends on how high it is. Because if it's, let's say if it's like 150 over 90, a lot of doctors will not put you on medication right away. They'll tell you to go home and start modifying your lifestyle and your diet. But what I'm saying is if you're just starting on blood pressure medicines, always keep a journal, because if your doctor is trying to adjust those medicines, they're going to go by that one reading they got in the office, which really, it should be average. So if you bring your journal in and you tell your doctor, these are the blood pressures I had for the times I've taken it, that doctor can look at those numbers and adjust, if needed, your blood pressure medicine according to your journal. Like I said, when you go in, they're just looking at that one reading and they're going off of that of what they should do with your blood pressure medication, depending on what it is. Now, if you go in now and it's 180 over something, they're going to adjust your medication no matter what. They're not going to tell you to go home and adjust your diet. That's too high to leave out of the office and say, cut down on your salt and whatever. 180, they're going to adjust your medication. But the main point I'm trying to make is just keep a journal so they can know what your readings are. The American Heart Association states that when you are adjusting your medications, just to see how it's going to work, you should do it twice a day for a week. And then after that, once or twice a week is when you can do your blood pressure. Now, if you want to do your blood pressure once a day in the morning and record it, I'm not saying you can't. I'm just saying that if your blood pressure stays stable, you can do it once or twice a week. And if you just feel more comfortable doing it once a day, which some people do, then you can do it once a day. Also, research for some reason shows that blood pressure is higher in the morning than in the evening. But I would say too now, you have to read into that. That's usually for patients, or I keep saying patients because I have been so used to working with patients. But that's for people most likely that have no history of high blood pressure. This is not going to always be the case if you're on blood pressure medicine, because it depends on what time of day you take it. Some people take their medicines in the morning, and then for some people it works better taking it in the evening. And I believe that's all I have today. I just wanted to get the hypertension out of the way and basically give some little tip or takeaways for the how to effectively take your blood pressure. I don't want to keep you too long again, But tomorrow we're going to talk about the congestive heart failure. That is really important with women in their menopause years. So until tomorrow, day 5, take care.